name is Cylie Williams. I'm a professor at Monash University in the School of Primary and Allied Healthcare. I'm also the course director for the Podiatry degree, the Doctor of Podiatric Medicine, and Deputy Head of School. I guess I'm late to academia. I was a clinician for 15 or so years before I decided to do my PhD. So I primarily worked in community health and in public health in large hospitals, and predominantly in a children's health role as a podiatrist. Worked in management throughout some of those jobs before deciding I wanted to do something a little bit more, and I decided to do my PhD, and since then my research and education roles have grown. I joined Monash University in 2017 when I obtained an NHMRC research fellowship, and then I've stayed there in some of the roles leading research programs. I've got three major areas of research at the moment. One particular and the largest stream is working with clinicians and families about developing a suite of work for children who have chronic lower limb pain. I have another suite of research which is on workforce and how do we remodel a workforce that is actually what patients want. So if a patient has a particular need, who is it that they need to wrap around them and what sort of skill set they actually need for that. And the third is around developing models of care, and this is led by colleagues in interstate around the LGBTIQA plus community and how we can deliver safe and effective care as health professionals. I think everyone who does serious research likes to have a little bit of fun as well, and one of our most recent projects was exploration of how Barbie has actually worn high heels over the time since she first launched onto the scene in 1959, and more recently what sort of shoes and what sort of foot positions she holds up until 2024. Needless to say, Barbie was not funded by anyone. Barbie was a love job of a bunch of academics who were curious, and when curious people get together, they often create a little bit of fun research on the side because they know how to research. Predominantly, my research is funded by the NHMRC and MRFF, or Medical Research Future Fund. And at times, I have had some footwear research funding, predominantly children's shoes though. I'm a clinician at heart. I love spending time with my patients, and what drives a lot of the work that I do is through hearing the stories that my patients are telling me, and can I be one of the people to solve them? Whether that's something as simple as what sort of shoes should my child wear, through to my child has pain, what sort of shoes or orthoses or what sort of health care can I help? Sometimes it's about unpacking myths. There's a lot of myths in healthcare. We carry sometimes a lot of baggage that we've been told about our bodies throughout our lives. And so some of my jobs from being a clinician and then moving to be a researcher is about researching some of those and seeing whether some of these stories actually are true, whether we can transform them into treatments, or whether there's some myths that we actually need to put to bed. Outside of the workplace, I've got an amazing family. I've got two very funny dogs, a cat, two lizards, a couple of chickens, even a duck. I have teenagers, older children now, and I love to sew. I can't sit still, so you will generally find me with a needle in my hand sewing something for sometimes. I like to make quilts for babies for my friends and spend time with my family and friends.